Okay. Hi, honey. How are you?
Hey, I'm doing well. How are you?
Good. So, today we're doing a discussion and a video on basically what the importance of pre procedure protocol is and why you really, as a physician, not just you, but also other physicians, why you have these kind of rules and protocols put into place in order to keep patients safe. I think that at the clinic, we get a lot of questions from patients who are wondering why you tell them to do certain things the night before they're getting a procedure done. So I just wanted to take this time to be able to kind of communicate these things and then just really educate our patients and our audience on why they're important and things you can do to ensure that your procedure goes safely and you really reduce the risk of complication. So to start off, let's just go over, you're having a procedure done, you have a patient who's coming in who has, let's just say, back pain, and you schedule them for a procedure. What are some of the things that you were telling patients the night before a procedure to not do or to do in order to prepare for their procedure?
Well, integrated spine pain and wellness, obviously our focus is on non-narcotic modalities. And one of the modalities we do focus on is interventional modalities. So these include musculoskeletal and spine procedures that are minimally invasive, but nonetheless invasive. So inherent with any procedure that we do, there are risks. Depending on what type of procedure, the most common are infection and bleeding, and then with some of our more elegant procedures, is risk of a nerve injury, potential complications that can be catastrophic, paralysis, stroke, and even death have been reported in some of the literature. So, my job as a physician is to do everything in my power to reduce those risks.
Right.
And some of those things we do, some of those things I've done is I'm double board certified and fellowship trained in anesthesia as well as interventional spine and pain management. Um, those credentials are very important when you're having someone perform these procedures. Again, we do everything under sterile conditions. All of my procedures are image guided, meaning I either use x ray or ultrasound so I can see where the needle tip is at all times. Um, Other things we do, I make sure patients have followed the pre-procedure protocol. So this begins not just the night of the procedure, but during the initial consultation.
Okay.
So, since you mentioned back pain and what I do for back
Yeah.
pain, these are considered neuraxial procedures or spine procedures. And there are risks associated with doing procedures in the spine: infection, bleeding, nerve damage, paralysis, stroke, death, all those catastrophic things.
Okay.
Um, so, what patients can do specifically, we ask them to stop any blood thinning medications or supplements, right? If they're on fish oil, vitamin E, a multivitamin, green tea, ginseng, uh, curcumin, turmeric, anything along those lines, we have a whole list of supplements we recommend patients stop. So typically, we want those stopped 7 days before because all of those supplements, even though they're very beneficial for overall health, they may have an effect on blood clotting and bleeding.
Okay.
And the last thing we want people to do is bleed in the spine.
Right.
Unfortunately, there's no way to stop the bleeding. And if people do bleed in the spine, this can result in an epidural hematoma, which can be a catastrophic complication requiring emergency medical surgery, or could result in paralysis or more serious complications. So we
Okay.
provide patients with all that information: what to stop, when to stop. Patients who are taking blood thinners, aspirin, baby aspirin, even a lot of patients are surprised that we have them stop a baby aspirin, but baby aspirin affects the platelets. That's why patients take it, to improve circulation throughout their cardiovascular system and to reduce the risk of blood clots. Well, when you have a spinal procedure, you want your blood to clot as soon as possible after the needle has been removed. I tell patients the needle is going to go through blood vessels. There will be bleeding. There's no way to prevent that from happening. But what we can do is prevent catastrophic bleeding. And so the big thing is stopping blood thinning medications. So aspirin is a big one. Even anti-inflammatories, we call these NSAIDs, non-steroidal
Yeah. Yeah.
anti-inflammatory drugs. So ibuprofen, Aleve, diclofenac, that's another big one, Nabumetone. All these medications can thin blood. So we have specific guidelines for each one that we have patients discontinue a certain number of days prior to their procedure. Patients are also taking more stronger anticoagulants, blood thinners, like warfarin, Plavix, Xarelto, Eliquis. So these medications are designed to significantly inhibit the clotting ability, and they have different pathways, and there are different guidelines for each one. It's an absolute contraindication to do a spinal procedure while patients are on these medications. So we coordinate care with the cardiologist or prescribing physician to, number one, see if it's safe for the person to stop these medications.
Okay.
Uh, if a patient's on Plavix, for instance, they're on it for a reason. They have a propensity to form blood clots. They have a history of a heart attack and have stents. So stopping this medication may increase their risk of forming blood clots and increase the risk of heart attack and stroke. So we coordinate with the cardiologist or the prescribing physician to determine whether that's a significant risk. If it is, well, then these procedures may not be an option for the patient. If it's deemed safe from the cardiology standpoint, then we have guidelines as to when they can stop the medication to safely undergo a spinal procedure.
Got
So
it.
those are the kind of things we look out for.
Okay.
Infection is also a risk. Anytime you break the skin, you're introducing a foreign object into the body. Um, we do everything under sterile conditions, but sometimes the bacteria can get into the skin and into the area that we're injecting. We do everything in our power to reduce that risk. Everything is done under very strict aseptic sterile technique.
Yeah.
Uh, we also let patients know if they have any active infections in any part of their body to cancel the procedure. If they're taking antibiotics, complete the antibiotics and reschedule the procedure for 7 days after they've completed the antibiotics to reduce the risk of infection and causing an infection in the area where we're working. So in the spine, an infection in the spine may result in an epidural abscess, which is another devastating catastrophic complication that could require surgery, several months of IV antibiotics, um, and that's not what we want to do. All the procedures we
Right.
do are elective, meaning that patients are choosing to do these procedures.
Right. Right.
These are not life-saving procedures;
Right.
they are life-enhancing, ideally,
Right.
right?
Right.
More
Of
quality
course.
of life.
Quality of life. Yeah.
Exactly, and they work well for many people. So, but that's a decision we make together. I make with the patient. I mean, my focus, yeah, I do a lot of interventions, but I give patients the option. I like to empower my patients to make a decision to see if it's right for them, and if it's not, we come up with other ideas and other modalities.
Mhm.
Um, because there are inherent risks with everything we do in medicine.
Course, absolutely. I mean, that's I feel like just life in general, but question for you. So you were talking about patients who, have issues with their blood clotting and they're on blood thinners. Do you ever have patients that have other blood disorders that actually cause their blood to be too thin and they need help with, taking a medication in order to help it clot? Which, of course, I forgive me, I'm not in the medical profession, so, I don't know the medical terms, and you can help me with that. But what would patients who have certain issues do if they wanna get a procedure done?
So the risks are exactly the same as the patient who's
Okay,
on blood thinners. So there are conditions, thrombocytopenia, low platelet count. You can have genetic disorders like von Willebrand's disease. So these are genetic conditions that can, or iatrogenic, meaning that they're caused by medications they're taking that can cause,
okay,
yeah, issues with blood clotting. So
right,
typically in those cases, patients are managed by a hematologist or oncologist. So
okay,
again, we discuss the procedure with the hematologist or oncologist. We get clearance to see if it's an option for them to undergo these procedures safely. We'll
okay,
have the hematologist check labs, including blood count, platelet count, clotting time, INR, which is a
mhm,
measure of how fast our blood clots. And
okay,
yeah, so we do all these kinds of things, PT, PTT, and based on the results, we'll make a decision as to whether or not it's safe to undergo these procedures.
okay,
The spine, that is. For joint and musculoskeletal, the risk is significantly less. So,
okay,
but we can talk about that if you want to. But
yeah.
Yeah, but as far as spine, there are bigger risks with spinal procedures just because of the area in which I'm working.
And I mean, you do, you know, you do several procedures a week. I mean, you're doing, probably hundreds of patients a month. What is the percentage of patients, when you have a patient coming in, what's the percentage that a complication could happen?
I mean, there's always a potential for complications, so I make patients aware of that every
Okay.
time some things are beyond our control.
Yeah,
I mean,
because the body kind of has a mind of its own, right? So you can do everything on your part to make sure, you're which is giving the patients the pre-procedure protocol, making sure that, your technique is sterile and, making sure that everything is good on your end. But the body sometimes can have a reaction or which is I would assume is rare, but can happen, is that correct?
for sure, and there are varying degrees of these reactions. The most common is what we call a vasovagal reaction, where
Mhm.
patients, when they're undergoing a procedure, their blood pressure will drop, their heart rate will slow down, and they'll feel like they're going to pass out.
Is that anxiety or
It can be anxiety induced. It
Okay.
can also be just in because of the area we're working. We are working with the nervous system, and sometimes the pressure of the injectate can stimulate that response as well.
Okay.
Sometimes local anesthetic effect, or I mean, we use lidocaine, we use marcaine, we use ropivacaine. These are all different types of local anesthetics for our procedures. When I inject those into the body, there is an inherent amount that gets absorbed systemically. So, what that means is it gets distributed throughout the body. It can get to the brain, and it can cause an anesthetic effect. So, patients
Right.
may feel like they're under some light anesthesia. They may feel like
Okay.
they're somewhat intoxicated. So, these are all minor complications, but complications that we have to be aware of. For example, when I do cervical spine procedures, whether
Mhm.
it's an epidural, a diagnostic medial branch nerve block, a radiofrequency ablation, whether the patient is getting sedation or not, I always start an IV for safety. Now,
Okay.
some may say that's overcautious, but with my training from Cleveland Clinic, that was routinely done during the time I trained 16, 17 years ago. So
Yeah. Yeah,
and so I've carried that on into my current practice as well, just for safety. It's
which
one
is
less thing we have
great.
to do. If there is a vasovagal episode, the IV is there. We can hang a bag of fluids, rehydrate the person, and let them recover on their own, which is the case 99.9% of the time.
Okay. Yeah, I mean, in even so I'm somebody who just I don't like medical procedures, it makes me nervous. I will do anything that I can to avoid it. But, now that we're working together and being married to you and just seeing how you do everything, you really do take every precaution necessary in order to keep patients safe, and just hearing you say that, it's not typically standard to start an IV before a procedure, I mean, and you said, you're saying how it might be too cautious. I feel like when you're doing these procedures, and especially when you have patients coming in, they're going to appreciate you being cautious and really being mindful with their safety. So, I think you can't be too cautious in this scenario.
Well, I would hope patients would feel that way.
Yeah, of
I know that many doctors practice differently.
course.
Um, for me, I'm not what's called a needle jockey. I really believe in giving patients the options and letting them know that everything I do is purely elective. Like I'm not
Mhm.
curing cancer or,
Yeah,
saving lives from heart attacks or strokes. So, this is quality of life.
yeah,
So
which
someone
is
sees
so important.
quality of life and not to compromise quality of life. So that's why this pre-procedure education is incredibly important. For some procedures, we do use light sedation. You were mentioning anxiety,
Yeah,
so that's very common. I mean, people are having things done to their body that they may have never had done before. These spine procedures can be a little nerve wracking for patients, and rightfully so. In those
absolutely.
cases, we use very light sedation. So the guidelines from the American Society of Interventional Pain Physicians and also the Spine Injection Society is to avoid heavy sedation. So all the sedation we do is conscious sedation, meaning the patient's awake, they can speak, they can have appropriate conversation. They maintain their own spontaneous respiration, meaning they can breathe on their own. So those are the guidelines, and that's what we follow at Integrated Spine Pain and Wellness. But in those cases, there are a different set of guidelines patients have to follow, which is a fasting guideline. When we give
Mhm.
these medications, there's a risk of nausea, there's a risk of potentially vomiting. And if a patient gets sedation and they're face down, a lot of the procedures I do are with patients face down. So if they have a full belly, they get the sedation and they start to vomit, they could aspirate into their lungs. And that could either cause a very bad pneumonia or inflammatory condition of the lungs, or even make require them to be intubated. So that's worst case scenario. So I unfortunately or fortunately, I've had to cancel several patients throughout my 15 years in private practice um, due to failure to comply with the guidelines for sedation as far as fasting guidelines. So typically we have, well, these are the guidelines for conscious sedation: no food for 6 hours before the procedure.
Mhm.
So most people, if we're doing them in the morning, they're not eating anyway after midnight. But later on in the day, if a patient eats at 9 a.m., then we do their procedure at 3:30. As long as they've been fasting for the full 6 hours, then they're relatively safe for the procedure. Um, there's also fasting guidelines for liquids. So liquids we define as clear liquids. The patient can have clear liquids up until 2 hours before the procedure, and these are non-carbonated clear liquids. So like water, for instance, black coffee, tea, as long as it's not green tea, because green tea can thin your blood and increase the risk of bleeding. So those are things we have patients avoid. Definitely no cream and sugar in their drinks if they are having coffee or tea. So we ask patients about this and explain to them why we do this. And
Mhm.
again, these are elective procedures, and if patients need to eat, well, then sedation may not be an option. Or if they need to
Mhm.
have their coffee with cream and sugar, and they can't wait the 6 hours, that's considered a meal actually. So the guidelines for coffee with cream and sugar or tea with cream and sugar are 6 hours. If they can't do that, then they may not be a candidate for sedation for their procedures. And I always recommend patients to not have a full stomach when they come in for any kind of procedure that's being
Mhm.
done medically,
Mhm.
um, at least in my practice. I'm sure there are some fields of medicine where maybe having a full stomach would be beneficial, like in the GI world. But in spine and pain, there's no reason to have a full stomach before you do a procedure, because there's always a risk of that vasovagal episode.
Yeah.
Some can become nauseated, and we just don't want patients to vomit and aspirate. That's part of the safety that we try to enforce.
Well, and I would say that's probably the most common question that I have seen patients asking is, "Why can't I eat before a procedure?" And, some patients, it can be a little bit of a pain for them, especially people who might be hypoglycemic and, whatnot, but we really try to communicate and educate the importance of, even if you think, oh, he's just doing this just to tell me what to do or tell me something. It really is important. All of the pre-procedure protocol, all of the things that you're telling patients to do prior to their procedure is for their safety. And I think that, when it comes to the food and the drink, I never knew that before being married to you. Having a procedure done in the past, doctor tells me, do X, Y, and Z, I'm going to do it. You don't really, as a patient, at least for me, I'm sure other people are different. You don't really think much about it. Okay. And you don't really understand why they're telling you this. So now, being married to you and talking to you about this and really understanding why it is so important not to eat or drink anything. And I was going to go back to, you were talking about aspiration. Just for anybody who's not familiar with aspiration, what does that exactly mean?
That's where your food particles go into your lungs, basically.
Oh, okay. And
Yeah,
that's what can cause the pneumonia and the infection.
exactly. Yep,
Okay. Yeah.
actually, yeah. Or just
Okay.
irritation, which requires intubation, which again is a disastrous complication. But I
Right.
always tell patients this is incredibly important. Never lie to your doctor
Yes.
before you have a procedure. Just
Exactly.
it's not smart.
Yeah.
If there's a complication related to false information, we may have a hard time managing it because we're not putting that into the differential for why the complication is happening. So it's incredibly important. I have had to cancel procedures. I've had patients drive several hours. They forgot to stop their blood thinning medication. I canceled the procedure. They get very upset, and rightfully so. But
Absolutely. Yeah.
my job is to not hurt anyone.
Yeah.
So I don't take it personally. My job is to practice safety. And so in those situations, I've done my job. It's
Yeah.
unfortunate, but
Absolutely.
we have the pre-procedure packet. I believe it's available online. And if it's not after this video, we should definitely make sure it is.
Yeah, I'll make sure.
But I'm scheduling these procedures in the office. When the
Mhm.
patient leaves, the checkout person at our office is giving the patient the pre procedure packet so they can review them,
Mhm.
go over the recommendations, the guidelines, and then call with any questions. So,
Well, and what we can do to ensure that patients have all of this information, I can actually tomorrow make sure that maybe, we're even emailing patients as well. So we're giving them, a handout, but then we're also emailing it so they have, something on their computer and they can reference it if they need to. But just so you don't run into those things where you're coming in for a procedure, because I feel like most patients that are coming in, they wanna get treated, they wanna feel better, they wanna be out of pain, and I'm sure that it can be really, frustrating and kind of, a little bit of a bummer as well when you come in and you realize, "Oh, I didn't stop a certain supplement or medication, and now I have to wait another week or 2 weeks depending on your schedule." So, we definitely wanna make sure we're doing our part to educate and tell each patient what they need to be doing before they come in. So, and that's another reason why we wanted to have this conversation too, is to really tell people the reasons behind the pre-procedure protocol and, the importance of it.
that's exactly right. Um, and most patients, unfortunately, don't even read the pre procedure protocol, but
Yeah,
I can't stress how important it is. I mean, there's a reason we put those together. They're
absolutely.
based on the guidelines provided by the American Society of Interventional Pain Specialists, American Society of Regional Anesthesia, and the Spinal Injection Society. So, um, this network of physicians together perform millions of procedures, and complications do happen even in the most
Mhm.
skilled hands.
Yeah.
So we do everything we can to minimize those complications and risks on our end.
Mhm.
But I always tell patients we're a team. So patients have to do their part.
Yeah.
No way around that. You have to do your part to ensure a safe procedure.
Right. Well, and as much as you want to get the procedure done, you also don't want to have a complication happen and then the pain that you're feeling then becomes exacerbated or another, issue pops up because, a blood thinner wasn't stopped or you ate before your procedure or, something along those lines. Like it really is to keep patients as safe as possible.
And another, you mentioned blood sugar. That's also a concern with diabetics.
Mhm.
So many of the procedures we do are cortisone injections or corticosteroids, so
Okay.
Depo-Medrol or dexamethasone. Those are the two most common ones that we use in our practice, and they can cause an increase in blood sugar or a spike in blood sugar. So I tell patients, make sure that you are, following your diabetic diet to maintain a blood sugar that's in as normal of a range as possible so we can
Mhm.
avoid any potential complications, which would include hyperglycemia, where the sugar spikes
Okay.
so high that it can cause a diabetic coma or ketoacidosis in some patients, which is a pretty severe complication from high blood sugar.
Mhm.
Those are also things that are outlined in the pre-procedure packet that
Okay.
we encourage patients to read and follow. But to ensure safety when it comes to our diabetic patients, we do check their blood sugar in the office the day of the procedure
Mhm.
before they come back to the procedure suite, just to make sure that their blood sugars are under control.
Well, and you have such a great team working with you when you're doing procedures. I mean, not only do we have a great team at the office every day, but the team that is with you on procedure days. I mean, I feel like you have handpicked each person because you know that they treat patients the way that you want them to be treated, and they also have the same kind of, I don't know if I wanna say bedside manner, but they're really cautious, really mindful about what they're doing and how they are, conducting the, procedures with you.
Yeah, all my entire team knows that I practice safety first, and I have a very low threshold for canceling a procedure if I think there could be a potential complication. So, and my nurses know that well. So, but we have great communication.
Yeah.
Uh, if there is a potential issue, the nurses will come, to the procedure suite and let me know that there is a potential situation, and then I'll go make the assessment with the patient and explain why we're going to proceed or why we're not going to proceed with
Okay.
the scheduled procedure.
Okay. So just to kind of finish up the conversation, if you can just give patients like really quick kind of like a checklist of things to do before they're coming in for obviously every patient's going to be different because everybody has, different medical history, but just kind of a rough kind of outline of what patients can do before a procedure to ensure safety.
Read the pre-procedure packet,
Okay.
call with any questions. I return all of my phone calls, maybe a day or two, but I will get back to patients when they call. Um, and then really just make sure that you're appropriate for the procedure and you feel like you want to proceed. These are purely elective. If a person is having doubts about proceeding with the procedure, it's okay to not do it, and we can discuss other options. But basically, take away home, read the pre-procedure packet, follow those recommendations and guidelines, and then call with any questions or concerns. And never lie to your physician. If you show
Yeah.
up the day of the procedure and you haven't followed any of those recommendations or guidelines, please be honest. Let us know so we can avoid any serious complications.
Yeah, that's great. It's a great conversation. I feel like patients will really, get a lot out of this and, be educated on all of the important things that we do at ISPW. So, thank you for explaining everything so thoroughly. If you guys have any questions, you can always reach out to us. You can reach out through our office phone line, which our phone number is on our website, www.ispwscottsdale.com. You can also email us at hello@ispwscottsdale.com as well. And if you have not only questions, but if you have different topics that you want us to address for future episodes, please let us know. So, thank you. Thanks, honey.